Good afternoon, everyone, and welcome to our webinar on Shale Gas and Oil Health Registry and Resource Network. We're really happy that you've chosen to join us today for this very important and I'm sure very educational conversation. First, I just want to introduce myself. My name is Krishna. For those of you who have not met me or have not seen me yet on one of these webinars, I work on Halt the Harm Network, and I'll be moderating today's session. Some quick housekeeping guidelines for today before we get started. Fear not, this webinar will be recorded and emailed to all registrants. And if you are experiencing any technical difficulties at all, you can chat Katrina Ledbetter in the chat box at the bottom part of your control panel. It should be on the right side of your screen if you're joining in by computer. You can also just email info@halttheharm.net with any questions and your contact info during the webinar, and we'll have someone get in touch with you to help troubleshoot. And last but not least, we will have a very short survey at the end of the webinar to get any feedback that you might have. We want to make sure that we'll share it with our team in the panels as well, so we make sure that we keep improving these webinars. So really quick how this webinar is going to work. Our panelists are going to start off with presentations and for about 30 to 40 minutes, and there's going to be a Q&A and hopefully a participatory discussion, open discussion at the end with panelists, as well as participants together at the end. So to ask a question again, we'll just go through at the bottom right of your dashboard, there is a box where you can ask a question or chat us, and we'll be collecting questions throughout the course of the webinar today. And again, if you're having technical difficulties, you can ask us a question as well. There's a couple different ways that you can ask us questions or get in touch with us. So now that we've got that out of the way, here are today's speakers. We're super lucky to have three amazing panelists today. We've got Jill Kreisky, Beth Weinberger, and Lois Bjrnsen. Really quick about the three. Jill Kreisky has been the Associate Director of the Southwest Pennsylvania Environmental Health Project, EHP, since 2013. Her responsibilities include connecting with university-based researchers and graduate student interns who contribute to the understanding of shale gas and oil health impacts through partnerships with EHP. Beth Weinberger is a researcher and communication specialist with the Southwest Pennsylvania Environmental Health Project. She's particularly interested in the impact of shale development on children and in the policy implications of documented shale development emissions and health conditions more broadly. She received an MPH from the University of Michigan and a PhD from Yale University. And last but not least, we've got Lois Bjrnsen, who's a mother of four and lives in Scenery Hill, Pennsylvania, about 40 minutes south of Pittsburgh. Lois owns two small businesses and lives in the Marcellus Shale field where natural gas development is rampant. She has been working to protect her children from air pollution from gas development for the past 4 years. Lois's work in the environment started when she got involved with Stop the Towers, a grassroots organization that helped stop a 5,000 kilovolt tower from being built in southwestern PA. So really quick before we get started, I'll talk a little bit about Halt the Harm. Halt the Harm is an emerging advocacy network really designed to connect, serve, and support the dedicated individuals and leaders working to halt the harms caused by fracking, such as yourself and the leaders and the panelists here today. Our goal is really to expand and strengthen the base of leaders and supporters in the movement, and to ultimately facilitate collaboration by developing services to support the work that leaders are doing with the tools and strategies they need to halt the harms of fracking in their local communities and ultimately win the fight nationally. So who are the leaders of Halt the Harm? Leaders in the network are individuals actively working and collaborating to help those living in communities negatively impacted by fracking. So a leader can really be anyone, whether you're a concerned parent who's organizing other parents at your local school against drilling, or a career organizer, or someone working professionally for a larger group. And leaders through the network are able to access these free resources and services online. A few of these listed here, like our leader directory, where you can email others directly or follow them on social media and find other folks working in the areas that you work in, campaign strategy and support, webinars like this one, and event support, just to name a few. So here's I took a screenshot of our site where we have an entire online library of all the webinars the network has put together, featuring several leaders and their work, all the way from investigative journalists, attorneys, and organizers providing safe drinking water to affected communities. Really a wide breadth of leaders and subject topics. So these are just some of the things we're working on this year, but we are always looking for ideas and suggestions from individuals like yourself, and we're always looking to grow and make sure that the network is accurately and effectively serving folks like yourself who are fighting the impacts of fracking. So some of you listening today may already be a leader, but if you're not one yet, you are in luck. Look out for me, from an email from me in the next week or so, giving you access to these resources online, and I will be following with everyone, and I'm happy to talk to you personally about any questions that you might have or to connect you to the right people who can answer them. So now I'll hand it off to Jill to start the presentation section of the webinar.
Hi, thanks, Prathana, and thanks to Halt the Harm for hosting this for us. We appreciate it, and we appreciate you all being on today. This is the webinar about the Environmental Health Project's Shale Gas and Oil Health Registry and Resource Network. This is most of you who know EHP know that the work we do is typically providing a public health response to residents whose health is impacted by shale gas development, helping to monitor air and water, doing health assessments. So today this is an introduction to a new additional service, the Health Registry. And we can go to the next slide. And if you go to our website, which is where the registry is located, you'll see that button you see in the middle of the page that says Join the Health Effects Registry. And of course our website is that address listed below. We'd like to start today by having you hear from Judy Campsey. She's a resident of Southwest Pennsylvania. She's also a retired nurse. And I think her introduction to why she's so in favor of a registry is important for understanding why EHP is doing this. So we're going to listen to a little bit of what Judy has to say today.
I am Judy Campsey, and I'm a retired registered nurse, and I live and have lived for over 40 years in a small rural community in southwestern Pennsylvania. I am, I would say, most concerned, not for myself, but for my 5-year-old granddaughter who lives just down the road. Now, Milena, her backyard, the local community park where we take her to play, and her school playground are surrounded by wells. And there are processing plants and compressor stations probably within a 10-mile radius. Many people report to their physician, they report to the protection agency, they report to the health department. But what we're feeling, most of us, is indifference. Indifference to the point that nothing that we seem to say about how we feel is being taken seriously. And I think part of that, in all fairness, is the fact that our symptomology is so vague. And it's probably so vague because of so many chemicals being exposed to. And all have different impacts upon different body systems. So this is my concern, and should be everybody's concern, that while we're dilly-dallying around trying to defend that there is no health connection or insist that there is, we don't know. It's the unknown. And until we know, we are in jeopardy because of the impact that we perceive and because of the impact that we're not aware of that we're having. So what we need is to collect that information and make it available to researchers so that they have something to analyze that's credible. And I think that the health registry, to me, is extremely important and something that we have needed for a long time. But I'm so happy that it's here now. And that's why I, as a nurse, and I, as living in the midst of all of this, strongly encourage you to consider participating in this health registry. We have the opportunity to make a difference by sharing our symptoms, our ailments, how this has affected our quality of life. We have the opportunity to provide all of that to people who are prepared to make an analysis and perhaps come up with some resolutions as to how we can be treated properly, how we can be protected properly, and how what we're experiencing now can be prevented for other people. As a nurse and a person living in this environment, I would like to encourage you strongly to enroll and participate in this health registry.
Great. We can have the next slide. So what we'd like to do now is to unpack some of what Judy said here. And I start by saying that when you go to the registry site, you can see a longer video with Judy and other people talking about their reactions, their thoughts about the registry. But today what we're going to do is answer the questions you see here. I'll spend a few minutes on those first three questions, defining the registry and explaining why EHP is hosting it. Then Beth will talk to you about logistics of enrolling and what comes after the registry and why you should participate. And Lois is going to wrap up with sort of a description of why she is a resident of Southwest Pennsylvania and someone exposed to shale gas development is in support of this project. So we can go on to the next slide. Prathana, can we go on to the next? Oh, there we are. So the registry. Here's a definition of a registry, and I think what is important to keep in mind is that it's a collection of health information for individuals that have a condition or have had an experience or who are at risk of having that condition or experience. And the point of the registry is to collect as much standardized information as possible. And that's so that researchers and others can compare one person easily with another person, compare their information. Okay, so we can go on to the next. So EHP's interest in this is that we know that there are people who have experienced exposures to harmful substances from the shale gas and oil development process. And we know that there are people with symptoms. We also know that there are many more people at risk because of their proximity to unconventional oil gas development, and especially if you're a vulnerable population member, if you're a child, or if you're an older person with health conditions. So knowing that these are important concerns, we see an important reason for registry. Next slide. So here are just a few more factors about what a registry is. It's an ongoing collection of information, and it can include just one questionnaire or questionnaires and health records. So some of you may be familiar with registries, for example, a cancer registry, where much information from many sources are collected. It's usually maintained by an organization which assures the data's security and monitors who has access. And again, you might have heard of registries like the 9/11 registry, which is maintained by the federal government, or maybe the Alzheimer's registry, which is maintained by nonprofit Alzheimer's organizations. They are in charge of the security and monitoring. And another important point about registries is they're available to researchers at various institutions who are looking at different questions. So it's not just a data set for one person, but for many. Okay, we can go on to the next slide. I thought it was important to talk a little bit about what a registry typically is not. And that's because once we started this project, people were telling me about all sorts of registries, and some of them really weren't registries. So there is a lot of good data collection going on, and but typically it's a one-time data collection effort collected by a single team or a single researcher. So for example, about 5 years ago now, a team from Yale University collected really great data about exposures to water and that might be contaminated from fracking in Southwest Pennsylvania. They also collected some health information, and they published an important article that was in Environmental Health Perspectives in 2014. That was great research, but it wasn't a registry. And likewise, there's a really terrific researcher out of Johns Hopkins University named Brian Schwartz, who is using information from the Geisinger Health System, ongoing collected data collected by the health system, to look at some impacts, potential health impacts, and but he's not using a registry, he's using an existing data set. And then the final point I'd like to make is that typically a registry isn't where you get your complaint about a health impact individually addressed. So the Environmental Health Project does this. We address individual health complaints, but if you want that kind of help from us, you don't go through the registry. This is a separate collection of information. Next slide, please. So what's in our registry? Well, for adults, there are questions to be answered about what you know about your exposures to air or water that may be contaminated by shale, gas, or oil, and what health symptoms you may have. And for children, there are similar questions that can be completed by a parent or a guardian. And then there are another set of questions for workers who work in the shale gas industry, since their work-related exposures and symptoms may be different. Next slide, please. We also have some unique features. One is that in determining how much access there will be to your data, you as an individual set your security settings. It's you who decides if EHP will see your data, or if you want other researchers to see your data, or if you want someone to contact you. If people are just looking at your data, they do not have your name attached to it. And an even more important feature may be that if you change your mind and decide that you want to use different security settings, that's available to you too. Now, in terms of who the researchers are beyond EHP who might see your data, if you allow it, the list is developed by EHP to encourage studies of questions that matter most to the community. Finally, I just want to reiterate that while the registry is not how we can address your individual issue, we're always available at our phone number or our email address to get that kind of help. Next slide. So why is EHP launching the registry? Well, we have 3 reasons, and the first is that researchers out there are trying to get a better understanding of how health effects and shale gas or oil exposure are related. But there's not a data set that has this. So rather than requiring that everybody go out and collect their own data, we're hoping that this is a way for people from across the country to contribute their data for researchers to look at. Secondly, we know that policymakers sometimes dismiss our individual descriptions of our health effects by saying, well, that's anecdotal, that happened to you, but we don't really, where's the data? And we're hoping that this registry can help policymakers recognize the size and scope of how big this problem is. And finally, and most important to us, is that if you sign up for the registry, EHP will be providing ongoing information about what we're learning from the registry data, and also providing summaries of the research that is coming out regarding health effects on shale gas and oil. And honestly, to our knowledge, nobody is doing this on the scale and in the way we are doing it. So we think that's a really important factor in launching the registry. Next slide, please. So who should join? Well, we ask that anyone living within 5 miles of shale gas or oil development join. If you're farther out, you know, we're saying right now that it's probably not a good fit. But if you're within 5 miles of a pipeline, of a well pad, of a compressor station, really any phase you know of, you are welcome to join the registry. And even if you don't have symptoms, we welcome you because we need to know both about people who do and don't. Next slide, please. And finally, in terms of what kind of individuals, well, pretty much everybody again. Adults, children under the age of 18, and again, you can have a parent or guardian fill out the information for them. Also, other people who may not be comfortable using an online system, they can designate the person who is going to assist in entering data, and also workers who are exposed from their industrial experience. Next slide. So now I'm going to turn it over to Beth to tell you a little bit more about the nuts and bolts here.
Okay, so this is Beth Weinberger, and I'd like to spend a few minutes talking about how the registry will look once you register and a little bit about how it works. First, it is only available online, and it's designed to be used on a computer rather than a phone. We know of a couple people who have had trouble when they've tried to register using a phone. I don't know if it works sometimes, but we're recommending that it be used on a computer. People without internet access will need to find a way to get it, maybe through a library or a friend or a relative. And as Jill mentioned, relatives can also fill out the registry on behalf of a child or a spouse or an older parent who isn't comfortable. Next slide. So this is the home page for the Shale Health Registry. From here, you'll register in that little yellow Start Now button. And registering entails entering some information about yourself so that we have demographic data for the registry. And we ask for an email address so that we can provide you updates. Because one of the primary functions of the registry is to provide data for researchers interested in the effects of shale gas and oil development. As Jill said, we've set up privacy settings which control who has permission to view your data and who does not, and we're very careful about this. And we start with the assumption that participants will not want researchers to have access to their names or any other identifying information, but you're also able to go into the site and change those settings if you'd like more or less access than what we've suggested. Next slide. Once you've registered, you'll start in on the questionnaire, and it should only take about 20 minutes. That's what we've been hearing from people who have already joined the registry. Here's an example of a question designed to record what sites are near your home. And for all the questions in the questionnaire, we just ask that you give the most accurate responses that you can. And there's always an option to skip a question if you don't understand the question or if it's asking you something you're not comfortable reporting. So here's what we've marked as near this person: quarter to a mile from a well pad and a hydrofracking wastewater impoundment, a mile to 2 miles from a compressor station. The person doesn't know whether there's metering stations or processing plants around them. They're not near a rail yard doing silica transport, and they're not sure about the waste site and the pipeline. And so that person would then push save and continue. And the next slide. And here's some additional questions about your potential exposures. And what you'll notice for these is there are percentages on the left. And this is pretty interesting. Once you've entered your responses for most questions, the registry will tell you what percentage of people already in the registry answered the way that you did. So the question about whether there have been any incidents or accidents within a mile of where you live, this person says none of those occurred within a mile. 41% of the people in the registry also said that. However, 27% reported a spill, 9% a fire. So it's sort of an interesting kind of immediate feedback. And so the same thing for reporting whether there's been heavy truck traffic associated with UOGD near your home. And so this person says, yes, there has been, as did 79% of the registrants already in the system. So next slide. Here's an example of how the health questions will look. You'll be asked whether you've experienced new or worsening symptoms in particular categories. And here it's the respiratory and cardiac categories. You'll be asked what symptoms you've had. And then for any symptom you report, you'll provide 2 more pieces of information. So at the top is just a list of symptoms, and you just go through and check what symptoms you've had since there's been drilling or processing near you. So this person has experienced shortness of breath and wheezing or difficulty breathing. And then along the left, you can see how that fits with what's already in the registry, just out of curiosity. Then as a follow-up question, to find out how often this symptom occurs, so the wheezing and difficulty breathing, and this person said it's frequent. And then in terms of sort of a temporal relationship, the last question has to do with when it began related to UOGD. So for this person, it's been a new problem since oil and gas development started near where they live. We've made this as user-friendly as possible, and we're always available for questions as you decide about the registry or once you register. Next slide. So to recap, the registry has 3 primary purposes: to provide you with updates, not only on what's going on in the registry, but also on what's going on in research related to health and shale gas and oil development. We also plan to help researchers connect with the data and also inform decision makers. And I think that informing decision makers might be interesting, particularly related to maybe children and proximity of these sites to their schools, and the parents pointing out what symptoms that they have been experiencing since those sites went up. Okay, next slide. And just to wrap up, I'm going to reiterate that we think joining the registry has important benefits both to you and to the larger effort to understand the health impacts associated with shale gas and oil. At the end of this presentation, we'll have our email addresses and a phone number up if people have questions going forward. We also should have time today to answer a bunch of questions. And I know the question of the value of self-reported data often comes up, so that might be something we want to talk about. But now I'd like to introduce Lois Bjrnsen, who lives in Southwest PA, and she's going to share a bit of her experience living near shale gas development and her perspective on the registry. So I hand this over to you.
Thank you, Beth. What you're looking at is some of the infrastructure around my home. This is about 1,000 feet from our house. This is a metering station that carries the gas and transports it to the compressor station and so on and so forth. So this is next to a farmer's field where cows graze all around it, and the well pad is just below this. And that is a 8-pad well pad that is fracked continuously for at least the past 5 years. Next slide, please. So these are my 4 children. This well pad, we can see from our bedroom window It lights up our bedroom window at night. This is a 27-acre well pad. They're supposed to be permitted for only 10, but it's the egg slicing permitting that goes on so that through each phase, more and more is added to each well pad. Next slide, please. This is my neighbor's home. To the right of the play set is a path that my children and my neighbor's child run and play here all the time from house to house. So this is to the right of my home. This is an existing well pad. Directly beyond the trees from the well pad is the impoundment pond that you can't see unless you're take aerial footage. Next slide. So this is connecting to a well on top of the hill, and where you can't see, again, is another well. So there's two wells within about 500 feet of each other. The house in this photo obviously is at the bottom, but what you can't see is there's another home that is directly next to the other two well pads. They lost their water last summer. Trees are dying on their property, and the industry companies insist that it's not an industrial site, and they're unable to sell their home. Next slide. So, so I think the reason that the health registry is so important is people that I know that have entered into litigation with companies have no way of reporting once they enter into litigation with companies their health effects and what has happened to them. And I think this is a vital way to have some of that information come forward for people. It's a way that I can report things for them, for my neighbors, for my community members, for myself, the health effects that my children and I have suffered, from bloody noses to rashes to asthmatic-like symptoms to bullseye rashes, and on, and that correlate with heavy fracking is going on. So I think the registry is excellent. It's very easy to use, and you can help people who aren't able to use that and do that for them. So I recommend it highly. And again, you want to contact everyone at Environmental Health Project, Jill Kresge, Beth Weinberger, and they can help you through it.
Thank you so much, everyone, Jill, Beth, and Lois. And I think, Lois, your point of, that these health impacts are real, and this is the first step to really documenting them in a way that the science and research community can turn into something that can be used for policy change and to make change actually happen. These impacts that people are feeling and going through are not imagined at all. And I think this is a really great project. So we've actually got quite a few questions already in the queue. I just want to thank everyone again for sticking with us today during the day, and all the panelists for their wonderful presentation. So we'll go ahead and get started and move to the Q&A portion. Again, if you have any questions, feel free to ask them in the bottom right-hand corner of your dashboard. There is a chat box where you can ask your question or chat us your question. You can also raise your hand, and we can try to unmute you, or we'll reach out to you if you want to just type in your question for us. And if you're joining in by phone, unfortunately it's a little more difficult, but it's not impossible. You can just, hopefully, if you're available to a computer, you can email us at info@halttheharm.net to ask our question. And if we don't get to you today, we will be taking questions even afterwards if you want to email us at that same info@halttheharm.net, and we'll be happy to send your questions to the panelists today. So we'll go ahead and get started. The first question we've got here is from Karen Speed, and I'm just going to, I don't think any of these questions are geared towards specifically any of you guys, Jill, Beth, or Lois, but we'll just go ahead and ask the question. It is, what experience can you share on methane migration and homes exploding? We've seen this happen in Colorado in 2012, and just Monday, another home mysteriously exploded and flattened to the ground in Firestone, Colorado. This is from Karen Speed.
This is Jill. We don't have a lot of experience with that. We do have a concern here at EHP about explosions and other sort of emergency situations in addition to the sort of short and long-term health effects that you get from much lower exposures. So I'm afraid we can't be very helpful on specifics of that. I would say in terms of the registry, you are certainly welcome to register, and there are questions about what kind of health impacts related to emergency situations there might be. Beth, do you have anything else you might add?
No, I don't think so.
Okay, great, thanks. So we'll move on to the next question from Harv Tilobam. I'm sorry if I'm mispronouncing your last name incorrectly. The question is, do we have any indication that this will affect or be used positively by decision makers, considering that it will probably be dismissed, attacked by the industry operatives and their politicians? An addendum to that question, how will you prevent false reports from industry similar to what they did with List of the Harmed?
So this is Lois, if I can answer to that a bit. I've had numerous meetings with local elected officials, both on the state and federal level. And what I can tell you is that, unfortunately, industry meets with the same officials that we do. So what makes this health registry so great is that it's undeniable. You cannot deny people's health effects from industry. And the one thing that we notice when we're in meetings that sways people are health effects, children's health effects, women's health effects, elderly health effects. So that's why this would be very important, that this is something concrete that you can take to elected officials and show them what is going on in your area.
Yeah. Thanks, Lois. And this is Jill. I would say also that that a number of researchers who have shown interest in using a registry use it to think about what questions they should look at more carefully. So if they see an association, and I'm just making this one up, but it seems plausible to me, between air emissions and people having respiratory problems, having more asthma, for example, then they can see that that's a question to research more carefully. They may not use the registry data for a formal academic study. They may go out and get a random sample of residents from an area near pipelines and well pads, but the ability to kind of figure out what are the most important questions to ask are there. So and once they begin producing the studies that are undeniable in the connections they're making, I believe that elected officials will respond to their constituents who are worried about those problems. And so that's kind of where we hope to go. You know, in terms of the question about whether or not people might enter data that's not true, you know, we cannot deny that that might happen. We hope it doesn't. We hope that people are honest about what they're doing. We haven't, to date, we haven't found this to be a big problem. Beth, do you have more?
Yeah, well, and I think on the concern about being dismissed by the industry representatives, I think that's most certainly going to happen, but I think that's okay. You know, it's what we expect, and we have a different perspective on quality research than industry does. So I think there's sort of mutual dismissing of some of the research. And so I think that doing a registry is better than not doing it. Gathering up a lot of data from people is better than not, in however it's going to be used.
And this is Lois, just one more thing. That again, when we are in meetings, they ask for things such as health effects and health registry. So this is huge, and this can combat industry falsehood, saying that, you know, what we're saying is not true, because it is. And then we're able to combat that. So I think it's highly important to have this.
Great, thank you so much. So next we have a question from Rob Leeton. The question is, can I share the registry information with my doctor?
Well, we'll be putting out reports periodically, and that can be used in whatever way people want to use it. So, so that is available. You won't have a lot of data just from when you register. I mean, that's kind of a tricky thing, but we'll be putting together reports every 6 months, I think, is our goal. And those reports can be taken to physicians or to meetings or where school board members, wherever you want to bring them.
Okay. The next question we have is from Lucas Jasso. The question is, are there physical registry forms available for those rural countryside individuals that do not have a computer?
Unfortunately, at this point, we do not have physical forms. We were able to put this registry together from through an organization called Genetic Alliance, who had funding from the Robert Wood Johnson Foundation, and it was strictly for an online survey because it allows us to do lots of sort of searching among the data and doing analyses. So our hope is that people who are outside of internet activity will be able to find a way to get somewhere with internet. We'd actually love if we had sort of ambassadors out across the country who are willing to help people who are in that position. But at the moment, we don't have anything. I suppose down the road, if we feel like we're really missing people and it would be important to get them, we might consider figuring something out. But we don't have that right now.
And Jill, your point of the ambassador, sorry, I just want to interject, is super important. And at the end of this, we'll be sending out a survey, and there is a spot there if folks are interested in volunteering in some way.
And I would add that we do encourage people who don't have access to internet at their homes to possibly visit their local libraries, where usually computer use is free, at least for a short period of time. That might be one way to have that kind of access. And if you're uncomfortable with working online, to bring somebody with you to assist you, because again, there is a way to do that.
Great. The next question is from Walter. So the question is, the Pennsylvania Department of Health states they also have a registry. Can you discuss if you share data with each other, and if health providers are very busy, who should they send their data to, you or the health department?
I think I can answer that question. The Pennsylvania Department of Health and the Colorado Department of Health both are collecting data now relative to health impacts. They're done in different ways, and since we're in Pennsylvania, I'll address that first. If you go to the Pennsylvania website, you'll find, if you Google on Health Registry or Marcellus Shale, I think, you will come up to a page that has a phone number where you can call, and they will ask questions and enter your data in a spreadsheet. My understanding is that they are developing some kind of reports, and they are also willing to follow up with you in whatever way the Department of Health can follow up, and presumably in collaboration with DEP. In Colorado, it is an online survey, and it's a very short survey, but there's follow-up provided by their staff, which includes a medical professional. We don't know what their questions are in Pennsylvania because they haven't shared them with us, so I can't really speak to whether or not we would ever share data with them. At this point, we are not. Both registries are quite new.
And I don't know that we're certain what will come out of their data, what kind of reporting they'll do out to the public. I don't think we have a sense of that.
That's right. I mean, we don't know what they're asking, so we can't really tell what they would report. They have a thought of doing some kind of reports, but I don't think they've specified how frequent those will be.
Great. The next question is from Tammy Murphy. The question is, does the anonymity of the health registry make it any less valuable to policymakers to other kinds of reported data?
Well, I think, I can't speak for all policymakers, but, any survey data is typically anonymous. So, when you survey large populations, that's how the data is reported, and no one person is identifiable in it. So it shouldn't make it less useful, I don't think. It's kind of the way research is done in many cases.
Okay, I can move on to the next question. The next question is from Stevie Lewis. The question is, do you have to register to see the data that you would see when you're putting answers in?
Yes. The only way that you can get to the questions is to register.
Great.
And it's because it really is a registry. It's a place for people to come put their information so that it can be used by us or by researchers. So researchers will have to kind of do an application through us so that we can approve of them looking at data. But other people will not be able to go in and look unless they have permission.
And in those 6-month reports that Beth mentioned, we would probably provide some summary information. But again, for you to see immediately the answer to every question or the responses, you would need to be a participant in the registry.
Great. So the next question is from Edward Ketyer. The question is, many people don't know where the closest point of O&G operations is in relation to their homes, schools, and places of work, well pads, compressor stations, pipelines, etc. Please tell us where people can find this information before entering the registry.
So this is Lois. What you want to do is you want to go to the Oil and Gas Threat Map of Pennsylvania. It's a very easy map to use. It's of all the oil and gas infrastructure all over the United States, but you click on Pennsylvania, and then there's a toolbar on the side where you type in your address, and everything will come up from the rate of asthma to the schools that it's near, to the health facilities that it's near. And so every dot that you see is unconventional gas wells. So that's a really good tool to use to find out and how close you live to one if you're not sure.
And I would
again the name of that so people can get it.
Right, it's the Oil and Gas Threat Map of Pennsylvania.
And I would add, as Lois pointed out, it also has information for the rest of the country, and we've been talking a lot about Pennsylvania here because that's where we're located, but people any place in the country are welcome to join the registry. So if you need to do this, find things close to you, the threat map is also useful for you. The other thing we would say is if you don't know the exact distance, but you know that you're close to something, your best educated guess is will suffice for the purposes.
So the next question we have is from Beth Weinberger. The question is, what kind of outreach is being conducted or considered to medical professionals and PESU departments, Pediatric Environmental Specialty Units, and other facilities to encourage participation in the registry system?
Well, we're at the beginning of our outreach. This is sort of, in some ways, our kickoff. So we have not specifically reached out to healthcare providers for the registry, but we have kind of a list of ways that we're going to get out into communities in Pennsylvania and across the country. And I think it would be terrific if healthcare providers could encourage people to join the registry. Sort of a mixed bag. Healthcare providers, some really appreciate that there are effects from the industry, and some physicians and other healthcare providers seem not so sure, not quite convinced yet.
And this is Jill. I would add that one small bit of promotion we have available for healthcare providers, or really anybody else who wants to help us promote this, is a postcard that gives a very short description and then how to access it on the website. And we are happy to provide postcards to medical offices that are wanting to have this information available. And we, like Beth said, this is early in our kickoff of advertising what we're doing. And we look forward to being able to speak to medical groups.
We also have a little sort of electronic packet of promotional information, like a potential Facebook type post, a few potential tweets, a one-page description of the registry, and a one-paragraph description of the registry. So we have that kind of thing ready to go also.
Great. So the next question we have is from Har Titelbaum again. He had a different question, which was, will this be a static assessment or a dynamic ongoing assessment? For example, assessment before or at the start of fracking, then ongoing assessment of any changes. And he sent a clarification. I think he meant to say, with people adding information to the registry, will there be data analysis happening over time for each person?
Well, this is Jill. Our intention is to revisit people at 6 months after they've entered into the registry and to ask for updates. What we are likely to do is provide a separate survey asking for updated information. But this is a piece that's still being developed. As Beth mentioned, we're working within the confines of the platform that was developed by Genetic Alliance that we use. And so we're still exploring how we can do that. But it is our intention, to the best of our ability within our system, to collect data on an ongoing basis.
Yeah, I mean, I think the goal of a registry is that it does collect information over time. And so one of the benefits of providing an update type survey every 6 months to a year is that we can see whether illnesses emerge over time, because nobody else at this point is tracking that kind of thing. And so so I think we'll be set to collect over time and to be able to watch those kinds of trends.
Great. So we'll move on to the next question. We only have a couple left. The next question is also from Walter Sue. The question is, if we know where well permits have been granted, why don't we fund a health environmental pre-drilling study and redo it after the drilling is completed to see if there are any changes in the air, water, and health symptoms?
Well, EHP actually is doing that in a few places, mostly looking at compressor sites before, or neighborhoods before a compressor site is built and gets online, and then after. So that's actually something EHP is doing. It's just separate from the registry. But it's a good point, because you gain a lot of really valuable data if you can compare the same households before and after something goes in.
And I would just add that, you know, we're pretty far down the line in terms of shale gas development, certainly in this part of the country, and in other parts like Colorado, Texas as well. Certain kind of environmental exposures have been tracked by the federal government in the past, by ATSDR, which is the Agency for Toxic Substances and Disease Registries. But they can only track this sort of before, during, and after kind of work to the extent they're funded to do it. And to date, there has not been funding to do any sort of registry work around shale gas or oil.
Great, and we had a question from Tammy Murphy. The question is, I think it's a comment and a question. Dr. Hassan Ali at the Department of Health has been contracted by Penn State to work at the Department of Environmental Health Epidemiology and assigned to receive health complaints related to fracking, and is responsible for entering the demographics, location, and information about health data. What is the difference between the EHP registry and the work of Dr. Hassan Ali? And I'm not sure if you guys are familiar with
We are. And this is the work that Stephanie is doing is the work that I referred to before, that if you go to the Department of Health website, you'll see a phone number that you can call, and they have some sort of survey. Again, they haven't shared what the questions are, but there is a survey that you take by telephone with them. They enter the data in a spreadsheet. They have an idea about doing some sort of report on that, but the specifics of that, I think you should ask the Department of Health what they're going to do.
And what I think we are offering that they may not offer is this connection to researchers who want to understand the health impacts. I'm not sure their system is going to have an eye towards research.
No, I think that's it.
Great. And so we have one last question. This is from Natasha Legger. And I'm actually, Natasha, I'm going to unmute you so you can ask your question. Natasha? Okay. So if you do have a question, go for, you can email us afterwards, and I'm happy to present your question to the panelists. So it looks like we have gone through all of our questions, and I think everyone had really, really great questions, and thank you so much again. You know, if you have any questions that didn't get answered or other questions come up that, you know, you didn't think of and you thought of later, we're happy to entertain those later. So thank you so much. If you were joining via phone or internet speed didn't allow you to view the slides or videos and other graphics, we will be sending everyone the recording from today, as well as other links if there are any ones that you didn't catch us talk about. And I just want to thank so much our leaders, Jill, Beth, and Lois today for sharing with us the work on this registry that they're doing. It's in its early stages, but I think this is a really great thing because it allows a lot of space for us to give feedback and also to understand how we can help and support this registry, participate, and spread the word about it. So thank you so much for taking the time to join us, and everyone on call and online who was able to participate. You can shoot us an email if you have any other webinar ideas. We do these very frequently. And also check us both out at EHP and Halt the Harm's website. So thanks again, and we look forward to seeing you all at our next webinar. So have a good day, everyone.
Great, thank you.
Thank you.